Nicole.
Good morning, Nurse Practitioner Ashley.
Yes, I just want to give you a little debrief on the patient in examining 4.
Okay.
So SM is a 31-year-old female admitted to the med-surg unit from the ED on 3/28/19 with a chief complaint of a burning sensation that has been occurring for approximately a month now. She states that she has been taking aspirin to help relieve the pain in the meantime, but she would continue to have pain for several hours afterwards with little to no relief, along with indigestion, feeling faint, nausea, passing excessive amounts of gas, and vomiting. Patient claims she took 3 tablets, 325 milligrams pills for the pain every time it would onset. Patient is alert and oriented ×4. Since admission to the hospital, she has not taken any more NSAIDs, and her lab work shows that there is no serum levels of the drugs left in her system. She has been diagnosed with non-hemorrhagic duodenal ulcer and has been prescribed Cimetidine PO 300 milligrams 2 times a day as part of her therapy.
Oh, great. Great. Let's go in and see her.
Okay, let's go.
Come in.
Hello, good morning. How are you doing today? I just wanted to say that I'm Ashley, your nurse practitioner, Ashley Smith, and this is your nurse. I just wanted to introduce her.
I'm
Nurse
Nicole Basilico.
Nice to meet you guys.
Okay, so I'll let you get to it. Have a good day.
Okay, great. I'm just going to perform some hand hygiene really quick, if you don't mind. Can I get your first and last name and date of birth?
Samantha Munhig, 5/13/87.
Okay, perfect. Just going to scan you in and check the provider's orders. Okay, perfect. Is this your mother?
Hi, my name is Susanna. I'm the mother.
Oh, nice to meet you, Susanna. Do you mind if she stays while I
she can
examine?
stay.
Okay, great.
She needs me.
Okay, so how have you been feeling today?
I'm still nauseous.
But she hasn't thrown up since last night.
Okay, I'll speak to the doctor about getting you on a as-needed medication for your nausea then. Do you have any allergies?
No.
We're going to be checking on your vitals every 4 hours, so I'm going to start by doing that. Okay, so your vitals are, your respiratory rate is 18 breaths per minute. Your blood pressure is 124/82 millimeters mercury. Your pulse is 89 beats per minute. And your temperature is 97.8 degrees Fahrenheit orally. And your O2 saturation is 98% on room air. Do you have any pain? And if so, can you rate it on a scale from 0 to 10?
Yeah, I'm in a lot of pain. I would say an 8.
I'm sorry to hear that. How would you describe the pain?
It's like a burning sensation.
When did you begin to feel this pain?
About a month ago.
Where do you feel the pain exactly?
In my stomach on the right side.
Okay. When the pain comes on, how long does it usually last?
I would say a few hours, but just feels like forever.
Do you take anything to make you feel better, and does anything ever make you feel worse?
I take a few aspirins, and I'm also under a lot of stress, and I've been drinking a lot, so that probably doesn't help.
When you take the aspirin, how many are you taking?
I would say 3.
Okay. Have you had any since you've been to the hospital?
No.
Okay. And how often do you drink?
Mostly on the weekends, but I have about 4 drinks.
Okay. And do you smoke?
I don't.
Okay. Do you have any other symptoms with this pain?
No, not really.
And do you have any other coping mechanisms for your stress other than drinking, such as therapy or exercise?
No, I don't really have time for that.
Okay, I can set up an appointment with a social worker for you then if you'd like. As for the drinking, that often and in that excess can cause other health issues, such as liver disease, and could possibly be related to the current state of pain you're having.
All right, that sounds good.
So, what have you eaten in the past 24 hours?
I've had some eggs for breakfast, and for lunch I had a burrito with some jalapenos, some hot sauce, chicken and cheese, and then for dinner I had some turkey chili.
Okay, so I just want to do an assessment of your abdomen, given your current state, and it looks like in your profile you were given a medical diagnosis of a duodenal ulcer via an upper endoscopy. This will help me get a better idea of what's going on, and then I'll administer your medication that was prescribed by your doctor.
Okay, sounds good.
Okay, so it looks like the practitioner prescribed Cimetidine 300 milligrams 2 times a day, once at 3 p.m. and again at 8 p.m. for your duodenal ulcer to be given to you orally.
How long does it take till it starts working?
I'm actually not quite sure. I'll find out for you before we administer the drug.
Okay, great.
Hello, this is Pharmacy Katie speaking. How may I help you?
Hi, this is RN Nicole Pasilko calling from D2 West. I'm with patient Samantha Mundang. Date of birth, May 13th, 1987, bed B. She had a question regarding one of her medications, Cimetidine. She wanted to know how long the medication will start to before it starts working. I wasn't quite sure. Could you let me know the onset, peak, and duration of the drug so I can let her know?
Therapy is done for at least 6 weeks to help treat any ulcers, but not usually longer than 8 weeks. Cimetidine will need to be administered with meals or immediately afterward eating. And at bedtime for a prolonged effect. It usually takes about 30 minutes for the drug to have the effect. And it should last for about 4 to 5 hours. The most effective time of the drug is about 45 to 90 minutes after taking the drug.
Okay, thank you. Are there any interactions I should know about?
I see that this patient had been taking aspirin. I recommend the patient to stop taking aspirin since aspirin is one of the risk factors of peptic ulcer. Also, just make sure she doesn't ingest anything with caffeine in it, as that can increase the caffeine levels and its side effect.
Okay, sounds great. So no aspirin because it could increase the side effects. The onset's 30 minutes, peak is 45 to 90 minutes, and the duration's about 4 to 5 hours. I'll make sure of all that. Thank you again. Okay, so I checked with the pharmacist and she said that the drug should start working in 30 minutes. The most effective time for the drug is about 45 to 90 minutes, and after taking the drug, it'll last for about 4 to 5 hours. She also let me know that you can't have anything with caffeine in it while on the drug, which will be for at least 6 to 8 weeks, as it can increase the effects of the caffeine overstimulating you. And you should also avoid aspirins, as it can worsen the ulcer.
Alright, thanks for letting me know.
I'm gonna go get NP Ashley Smith back in here so that we can look at your labs and make sure everything's okay.
Alright, sounds good, thanks.
Okay, great.
Come in.
Hello again.
Hi.
Just perform hand hygiene. Results of your lab values. You are positive for H. pylori, which is a bacteria that infects your stomach and is a leading cause of duodenal ulcer, which explains how you may have gotten the ulcer in the first place. Also, some lifestyle factors you may want to adjust would be either to stop drinking, drink less often, and no more than 1 drink a day. Nurse Nicole mentioned that you have a lot of stress, and she was going to collaborate with therapists to see if that could be of help relieving some of the stress. As that you can see, the ulcer worsens as well.
How does the drug work?
So, this drug is an inhibitor of histamine in gastric parietal cells at the H2 receptor site, thus preventing gastric acid secretion.
What does that mean? Can you tell me in simpler terms?
So this drug basically stops the gastric acid levels of your stomach from being secreted, which will worsen the ulcer.
Oh, that's what it means. Thanks.
You're welcome.
Just so you know a little bit more about the drug, while you're here, I'll of course continue to assess you for any abdominal pain, blood in your stool, vomiting, and so on. That could speak to your ulcer worsening rather than getting better. So we know if we need to adjust the therapy at all. Medication compliance is very important for your ulcer to heal properly. If you miss a dose, it must be taken right away, unless of course it's too close to your next dose.
Are there any side effects I should know about?
There are also some potential adverse side effects to be aware of, such as arrhythmias, which are irregular heartbeats, aplastic anemia, which is when your body stops producing enough new blood cells, agranulocytosis, which would be a low white blood cell count. But if you notice any of the following, you must tell your practitioner immediately, which would be tarry black stool, sore throat, fever, dizzy, rash, diarrhea, hallucinations, and/or confusion, as that can be a sign of your condition severely worsening.
Okay, I'll be sure to let my practitioner know if I have any changes with my bowels or rashes.
Okay, great. We will be monitoring your labs such as your CBC, cultures, your vitals such as temperature, and overall assessment every few hours to ensure that none of these occur. And if they do, we'll treat them right away. Okay, so I'm going to get your medication together.
Okay.
So I just have to do my 3 medication checks. So I take it out of my drawer. I'm going to see, it says Cimetidine, 300 milligrams. Okay, compared to the EMR. Cimetidine, 300 milligrams, twice a day. Okay. Put them here. Okay. And then my 3rd check. Can I get your first and last name and date of birth again?
Samantha Munhank, 5/13/87.
Okay. Great. Looks like everything checks out. So here you go.
Thank you.
Wait, I have a question. Are there any diet restrictions for my baby? Because I want to make tamales for her. She loves tamales.
I'm sorry, but she can't take any tamales because she's on a bland diet until her peptic ulcer heals.
Okay, in my culture, Mexican American, tamales are a popular dish to make, and my daughter loves tamales. I have to make it for her.
I'm sorry, she wouldn't be able to eat tamales. It is probably best to limit spicy foods until it heals. After that, she can have tamales once in moderation. She should slowly increase exercise and increase fiber to prevent constipation and increase fluids.
Is there anything else we can help you with?
No, you've been very helpful. Thank you.
Your call bell is here in case you need us for anything.
Oh, great. Thank you. Come in.
So how are you feeling?
I'm feeling a little bit better.
Okay, that's good to hear. As your therapy progresses over the next few weeks, everything should continue to get better. In the meantime, we'll keep an eye on you to make sure the drug is effective, which will know if you have a decrease in heartburn, less pain in your abdomen, decreased feelings of sour stomach, and/or decrease in acid indigestion. And of course, that the ulcer heals and you have you don't have any GI bleeds or irritation that occurs throughout the therapy.
Okay, sounds good. Thanks.
Of course, let me know if you need anything. Again,
Will do.
you have your call bell.
Will do. Thanks.
Great. Just documenting one more time.